Let's talk about implant sizing or reconstruction. This is a tissue expander. This is commonly placed for first stage reconstruction at the time of mastectomy. And in this device, which you can see here, this has been filled to about 330 cc's of saline. But this is not a permanent implant. This is best described as Tupperware underneath the skin. Patients really don't like the feel of it. It's thick, there's a port, there's tabs, it's uncomfortable. It serves its purpose, which is to preserve the skin and allow us to expand, but long term, this is not going to be a forever option. When I'm thinking, what size should this patient be? Usually I'm going to go anywhere from 50 to 100 cc's larger than what's being filled in the expander. So this is a 330 cc silicone gel implant. This is the size where we place these in first, but this is a moderate high extra projecting versus a 340 boost. So the differences between these two, besides the fact that it's just 10 cc's of silicone difference, is that this has a more cohesive, thicker gel, and this one has a softer gel. When I compare them next to each other, you can see this is a much wider implant. Basically same amount of volume. This one is much wider. This one is narrower than this one. This one has a much thicker cohesive gel. This is a softer gel. And then on the side, you can see that the moderate high has more projection than the boost. This is just a moderate plus boost. This is a moderate high. So there are a lot of factors that go into determining what type of implant is best going to suit each individual patient for breast reconstruction. And so that's why sizers are so important, because they're sterilizable and I can put them in while the patient's asleep to determine which is going to be the best custom shape for her, ultimately for her reconstruction.